Good day, ma'am. I'm Abdul Hakidi Malen from 3BSNB, and today I will be performing the EINC, or the Essential Intrapartum and Newborn Care, also known as the Unang Yakap. It was conceptualized in order to have early initiation of breastfeeding. The purpose is the promotion of breastfeeding prior to woman's transfer to the delivery room. First is to ensure that the mother is in her position of choice while in labor. Then next is to ask the mother if she wishes to eat or drink or avoid. Gusto mo bang uminom or umihi muna bago ang proseso? Then the next is to communicate with the mother and inform her of progress of labor. Okay, ma'am. Ilang minuto na lang po ay malapit na pong lumabas ang anak ninyo. Then, assuming that the woman is already in the delivery room preparing for delivery. Then, check the temperature in the delivery room area to be 25 to 28 degrees Celsius. 25. Then, ask the woman if she is comfortable in the semi-upright position. Ma'am, comfortable ka ba pag semi-upright position? Then, ensure the woman's privacy. Then, after ensuring the woman's privacy, remove all jewelry. Wash your hands, thoroughly observing the World Health Organization 1 to 5 procedure. Then, after removing my jewelry, then I wash my hands, following the World Health Organization 1 to 5 procedure. Then after washing your hand, prepare a clean newborn resuscitation area on a firm and flat surface. So this is the clean, flat surface resuscitation area. Then check equipments if clean, functional, and within easy reach. So these are the equipments and in an easy reach. Then arrange materials, supplies in a linear sequence. So in the first tray, 2 pairs of sterile gloves, this, then 2 pieces of dry linen here, then 1 bonnet, here's the bonnet, 1 oxytocin injection, then 1 piece 3cc syringe here, 1 plastic cord clamp, 1 surgical scissor, instrument clamp or forceps, then the kidney basin. Then in a separate sequence for after the first breastfeed, the eye ointment, the stethoscope, the hepatitis B and BCG vaccines, cotton balls, vitamin K injection, hypodermic 1cc syringe for vitamin K. Then after checking the equipments, proceed to the perineal flushing. First, you need to wash your hands before the procedure, following the World Health Organization 1 to 5 procedure. Then assemble and bring the equipments on the bedside. Here are the equipments. Then screen the patient and explain the procedure. Okay, ma'am, bago tayo magsimula, maghugasan muna natin ang iyong maselang bahagi ng katawan para maayos na lumabas ang bata. Then, don your gloves. Okay, siya. First glove. So after ensuring that the gloves is worn properly, drape the patient exposing only the part to be clean. So this is the drape. Then using pickup forceps, perform the perineal flushing. Get cotton balls soaked in cleansing solution plus and clean starting from the mons veneris or far side going to the labia majora towards the anus, then discard. Then get another cotton ball and clean from mons veneris or far side to the labia minora towards anus, then discard. And then do likewise on the opposite side or in the near side. And then discard. Then clean the groin far side first, then flush thoroughly with sterile warm water. Okay, clean. And then flush thoroughly with sterile or warm water. And then dry the area using the same stroke as the procedure. Then dry. Remove the bedpan and turn the patient to side if necessary. So assuming that there is a bedpan, then remove it. Then spray antiseptic if needed. So this is the antiseptic, so spray it. Then put perineal pad with an up-down motion if needed. So assuming that this is the perineal pad, then put it and position the patient comfortably. Do aftercare of the equipment and then remove the gloves. And after that, cleanse the perineum with the antiseptic solution or betadine. So that is the perineal flushing. Then wash your hands and put 2 pairs of gloves aseptically. Then after doing the perineal flushing, just wash your hands again for to avoid spread of microorganisms. Assuming at the time of the delivery, assuming at the time of the delivery, before you proceed is to put on 2 pairs of gloves after washing your hands. after putting the 2 pairs of gloves, assuming at the time of the delivery, encourage the woman to push as desired. Okay, ma'am. At the count of 3, just push. 1, 2, 3, push. Then, drape the clean, dry linen over the mother's abdomen or arms in preparation for drying the baby. This is the clean, dry linen. Drape it in preparation for drying the baby. Apply perineal support and do controlled delivery of the head. Okay, ma'am. At the count of 3, just push. 1, 2, 3, push. Okay. Call of time of birth and sex of the baby. Okay, baby boy out, 3:30 p.m. in the afternoon. Then inform the mother of outcome. Then inform the mother of outcome. Thoroughly dry the baby for at least 30 seconds, starting from the face, head, going down to the trunk and extremities, while performing a quick check of breathing. Then, during the 1 to 3 minutes, remove the wet cloth and place the baby in skin-to-skin contact on the mother's abdomen and chest. Then remove the wet cloth. Cover the baby with dry cloth and the baby's head with bonnet. This is the dry cloth. Then the baby's head with bonnet. Then exclude a second baby by palpating the abdomen in preparation for giving oxytocin. Then give IM oxytocin within 1 minute of baby's birth after wiping the soiled gloves with the wet cloth. Then dispose the wet cloth properly. So before giving the IM oxytocin, wipe first your soiled gloves. Wipe. Then dispose it properly. Then give the IM oxytocin. After giving the IM oxytocin, remove the first set of gloves after positioning the baby for cord clamping. Then remove the first set of gloves. Then decontaminate the first set of gloves in 0.5 chlorine solution for at least 10 minutes. Then palpate umbilical cord to check for pulsations. And then after that, after pulsations stop, clamp the umbilical cord using the plastic clamp or cord tie and 2 centimeters from the base. So this is the 2 centimeters from the base. And then place the instrument clamp 5 centimeters from the base and then cut near plastic clamp, not midway. Perform the remaining steps of active management of the third stage of labor. Wait for strong uterine contraction then apply controlled cord traction on the uterus continuing until placenta was delivered. Okay. So this is the placenta, then put it in a container. Then massage the uterus until it is firm. Then inspect the lower vagina and perineum for lacerations, tear and reverse laceration or tears. Okay. Then examine the placenta for completeness and abnormalities. So this is the placenta. Examine it for completeness and abnormalities. Cleanses the mother perineal care or flushing, then apply perineal pad or napkin or cloth. Then perform again the perineal flushing. Other side, then discard. And then wipe it with warm water. Then dry it using a clean cloth. After doing the perineal flushing, check the baby's color and breathing. Check that the mother is comfortable and that the uterus is contracted. Check the baby's color. Okay, it is pinkish, so that is normal. It's unhealthy baby boy. Then dispose of the placenta in a leak-proof container. So this is the placenta, then dispose it using in a leak-proof container. And then advise or decontaminate instruments before cleaning. Decontaminate second pair of gloves before disposal, and starting that decontamination lasts for at least 10 minutes. So remove the second pair of gloves, then decontaminate it and the used instrument using this. And then advise the mother to maintain skin-to-skin contact. The baby should be prone on mother's chest in between the breast with the head turned to the one side. So ma'am, just maintain the skin-to-skin contact because it performs the baby and the mother's bond. Then, by 15 to 90 minutes after giving her birth, advise the mother to observe for feeding cues and cite example of feeding cues. So, ma'am, kapag kinagat yung bata yung daliri niya or yung thumb niya, or kapag hinanap niya yung nipple mo, ibig sabihin yun, pwede mo na siyang padidiin. Then, support mother, instruct her positioning and attachment. Wait for full breastfeed to be completed. Okay, ma'am. Tapos na po ba? Nakadede na po ba ang anak nyo? Okay. After a complete breastfeed, administer the eye ointment, read a thorough physical examination, then give vitamin K, hepatitis B, and BCG vaccine. Okay, ma'am. Hiramin ko lang saglit ang anak nyo. Okay. First is the eye ointment. Inner canthus up to the outer canthus. Then the physical examination. Okay, the baby is pinkish. That means this baby is healthy. Then administer the vitamin K. The vitamin K. The vitamin K and the hepatitis B. And then the BCG vaccine. Then, after that, advise optional or delayed bathing of the baby. Okay, ma'am. Huwag nyo munang paliguan ang anak nyo to prevent hypothermia. Then, advise breastfeeding per demand. Ma'am, kapag napansin nyo sa anak nyo yung sinabi kong feeding cues kanina, padidiin nyo po yung baby. Then, in the first hour, check the baby's breathing and color, and check the mother's vital sign and massage uterus every 15 minutes. Okay, inspect the baby again, and then give it back to the mother to maintain baby and mother bond. And then check the mother's vital signs. Then, in the second hour, complete all the records. That's all for EINC, or the Essential Interpartum and Newborn Care, or also known as the Unang Yakap. Thank you.